Is ALS hereditary? Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a progressive neurological condition that affects nerve cells in the brain and spinal cord, leading to muscle weakness and eventually paralysis. Genetic factors. ALS can be hereditary in some cases, but it's important to note that the majority of ALS cases are sporadic, meaning they occur without a family history of the disease. Familial ALS, FALS. This accounts for about 5–10% of all ALS cases. In these cases, the disease is passed down through mutations in specific genes. A person with a family history of ALS has an increased risk of developing it. Sporadic ALS. This form occurs randomly and does not have a family history connection. Inheritance pattern. Familial ALS is typically inherited in an autosomal dominant pattern, which means that only one parent needs to carry the mutated gene for the child to inherit the risk of developing ALS. How is ALS diagnosed? Diagnosing ALS can be complex, as there is no single test for it. Instead, doctors rely on a combination of methods to rule out other conditions and confirm ALS. 1. Medical history and symptoms. The doctor will start by asking about the person's symptoms, family history, and any neurological issues, such as muscle weakness, difficulty speaking, or swallowing. 2. Physical and neurological exam. This includes assessing muscle strength, reflexes, coordination, and muscle tone. 2. It helps to identify any abnormal muscle function. 3. Electromyography, EMG. This test measures the electrical activity in muscles. 3. In ALS, the electrical activity in the muscles will show signs of degeneration. 4. Nerve conduction studies. This test checks how well electrical impulses travel through the nerves. 4. It helps to rule out other nerve disorders that might mimic ALS. 5. Magnetic resonance imaging, MRI. An MRI scan of the brain and spinal cord can help rule out other causes of symptoms, such as tumors or structural problems. 6. Blood and urine tests. These can help exclude other conditions that could be causing the symptoms. 7. Muscle biopsy. Rare, in some cases, a small piece of muscle tissue may be taken to check for abnormalities. Note: since ALS symptoms overlap with other conditions, it often takes time to get a definitive diagnosis, and a diagnosis of ALS is typically made after ruling out other diseases.